How sleep quality changes after 60 and what science says to fix it. Sleep is one of the most essential pillars of health, yet many people over 60 find it increasingly difficult to get restful, restorative sleep. Understanding why sleep quality changes as we age, and more importantly, how to improve it, can have a profound impact on overall health, brain function, and longevity. The importance of sleep for older adults. Sleep is critical for physical repair, memory consolidation, emotional regulation, and immune function. For people over 60, quality sleep becomes even more important, as the body and brain need more time to recover from decades of wear and tear. However, studies show that about half of adults over 60 report sleep problems, including difficulty falling asleep, staying asleep, or waking too early. These changes are not just inconvenient. They are linked to increased risks of heart disease, diabetes, cognitive decline, and depression. How? Sleep changes. After 60, changes in sleep architecture. As we age, our sleep architecture, the structure of our sleep cycles, undergoes significant changes. Older adults spend less time in deep, slow-wave sleep, also called restorative sleep, and REM sleep, which are crucial for healing and memory. Instead, light sleep stages become more frequent. This results in more frequent awakenings and feeling less refreshed. Circadian rhythm shifts. The body's internal clock, or circadian rhythm, shifts earlier in older adults. This means many people over 60 become early birds, feeling sleepy in the early evening and waking up very early in the morning. While this shift is natural, it can cause issues when social or family schedules don't align with these changes. Reduced melatonin production. Melatonin, the hormone that signals to the brain it's time to sleep, decreases with age. Lower melatonin levels can make it harder to fall asleep and stay asleep throughout the night. Increased prevalence of sleep disorders. Older adults have a higher chance of developing sleep disorders such as insomnia, sleep apnea, restless leg syndrome, and periodic limb movements. These conditions disrupt sleep and often go undiagnosed. Medical conditions and medications. Chronic pain, arthritis, urinary problems, acid reflux, and medications for blood pressure, depression, or other conditions can interfere with sleep patterns. What science says to fix sleep problems. After 60, the good news is that while these changes are natural, they don't have to control your life. Scientific research points to practical, effective strategies to improve sleep quality in older adults. Subscribe to the channel for more videos. Like and comment. 1. Maintain a consistent sleep schedule. Sticking to a regular bedtime and wake-up time every day, even on weekend, helps regulate the circadian rhythm. Going to bed and waking up at the same time reinforces your body's internal clock, making it easier to fall asleep and wake naturally. 2. Create a sleep-friendly environment. Your bedroom should be a sanctuary for sleep. Keep it cool, dark, and quiet. Use blackout curtains, white noise machines, or earplugs if necessary. Invest in a comfortable mattress and pillows that support your body properly. 3. Limit exposure to blue light before bed. Screens from phones, tablets, and computers emit blue light, which suppresses melatonin production. Avoid screens at least 1-2 hours before bedtime. Consider using blue light filters or glasses if screen use is unavoidable. 4. Get regular daytime light exposure. Natural daylight helps keep your circadian rhythm on track. Try to spend at least 30 minutes outside each day, especially in the morning. This exposure reinforces your body's sleep-wake cycle. 5. Exercise regularly, but not too late. Physical activity improves sleep quality by reducing stress and tire the body naturally. Aim for moderate exercise most days, but avoid vigorous workouts within 3 hours of bedtime to prevent stimulation. 6. Avoid caffeine, nicotine, and alcohol close to bedtime. Caffeine and nicotine are stimulants that can disrupt falling asleep. Alcohol might help you fall asleep initially, but reduces REM sleep and causes more awakenings later in the night. Try to avoid these substances 4-6 hours before going to bed. 7. Practice relaxation techniques. Stress and anxiety can worsen sleep difficulties. Techniques like meditation, deep breathing, progressive muscle relaxation, or gentle yoga before bed can calm the mind and prepare the body for sleep. 8. Subscribe to the channel for more videos. Like and comment. Consider melatonin supplements carefully. Research suggests low-dose melatonin supplements can help improve sleep onset in older adults with low melatonin levels. However, melatonin is not a long-term solution and should be used under medical advice. 9. Address medical conditions and sleep disorders. Consult your healthcare provider about sleep issues, especially if you snore loudly, wake gasping for air, or have restless legs. Treating underlying medical problems or sleep disorders is essential for restoring good sleep. Additional tips for improving sleep quality. Limit naps. While short naps can be refreshing, long or late afternoon naps can interfere with nighttime sleep. Eat light before bed. Heavy meals close to bedtime can cause discomfort and indigestion, disrupting sleep. Hydrate wisely. Drink enough fluids during the day, but reduce intake in the evening to minimize nighttime bathroom trips. Keep your mind active during the day. Cognitive stimulation helps maintain brain health, which supports healthy sleep patterns. Why improving sleep? After 60 matters. Restorative sleep is not just about feeling rested. It plays a key role in maintaining memory, supporting immune defenses, regulating mood, and even controlling weight. Improving sleep quality after 60 can reduce the risk of developing Alzheimer's and other forms of dementia, improve cardiovascular health, and enhance overall quality of life. Summary. To recap, sleep naturally changes after 60, with lighter, more fragmented sleep and an earlier internal clock. However, science shows us that we can improve our sleep through consistent routines, healthy habits, and by addressing medical issues. If you or a loved one struggle with sleep, small changes can lead to big improvements, helping you feel more energetic, focused, and healthier every day. Deep dive. Why does sleep get worse after 60? Aging affects every system in the body, including the brain circuits that regulate sleep. Research shows that the hypothalamus, the brain region controlling the sleep-wake cycle, experiences structural changes with age. Neurons that promote deep sleep gradually diminish, reducing the intensity and duration of slow-wave sleep. At the same time, the pineal gland produces less melatonin, and this hormone secretion becomes irregular. The result? You might find yourself waking up multiple times at night or struggling to fall asleep in the first place. Moreover, age-related inflammation known as inflammaging can disrupt the sleep process. Chronic low-grade inflammation interferes with the body's ability to regulate sleep hormones, contributing to lighter, less restorative sleep. Common sleep disorders in older adults. Insomnia. Difficulty falling asleep or staying asleep is the most common complaint. Up to 40% of older adults experience chronic insomnia, which worsens quality of life. Sleep apnea. This is a condition where breathing stops briefly during sleep, leading to frequent awakenings and poor oxygen levels. It affects about 20% of people over 60 and increases risk for hypertension and heart disease. Restless leg syndrome, RLS. Characterized by uncomfortable sensations in the legs and an irresistible urge to move them, RLS can delay sleep onset and cause multiple awakenings. Periodic limb movement disorder. Involuntary jerking of limbs during sleep, often linked with RLS. Further fragments sleep. How lifestyle affects sleep in older adults. Your daily habits dramatically influence how well you sleep at night. Diet. Eating a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats supports overall health, which translates to better sleep. Avoid heavy or spicy meals before bed to prevent indigestion. Hydration. Proper hydration is key, but excessive fluid intake before bedtime can cause frequent bathroom trips, disrupting sleep. Physical activity. Regular moderate exercise improves sleep quality, but exercising too close to bedtime can be stimulating and disruptive. Social interaction and mental stimulation. Engaging socially and keeping your brain active through reading, puzzles, or learning helps maintain cognitive health and promotes good sleep. The role of napping. Napping can be a double-edged sword for older adults. Short naps, 20-30 minutes, earlier in the afternoon can boost alertness and mood without interfering with nighttime sleep. However, long or late naps can reduce sleep drive and delay bedtime. Technology and sleep tracking. Today's technology offers tools that can help older adults better understand their sleep patterns. Devices like wearable trackers and smartwatches provide data on sleep duration, quality, and disturbances. However, while helpful, these devices aren't perfect and should be used as guides rather than definitive diagnoses. Scientific treatments for sleep problems in older adults. Cognitive behavioral therapy for insomnia, CBTI. This evidence-based approach helps change negative thoughts and behaviors around sleep. CBTI is considered the gold standard for treating chronic insomnia without medication. Light therapy. Exposure to bright light in the morning can help reset the circadian rhythm, especially in older adults experiencing early sleepiness or fragmented sleep. Pharmacological options. Sleep medications are sometimes prescribed, but should be used with caution. Many sleep aids can cause side effects or dependency, especially in older adults. Brain health and sleep. A vital connection. Poor sleep quality is linked to increased risk of neurodegenerative diseases like Alzheimer's. During deep sleep, the brain's lymphatic system clears waste products and toxins, including beta amyloid plaques associated with Alzheimer's. Insufficient deep sleep impairs this cleansing process. Maintaining good sleep hygiene is thus a protective factor for brain health as well as overall wellness. Practical sleep hygiene tips for after 60. Limit clock watching. Constantly checking the clock during the night can increase anxiety and worsen insomnia. Turn the clock away from view if needed. Avoid stimulating activities before bed. Engaging in stressful conversations, watching intense TV shows, or working late can interfere with the wind-down process. Develop a calming pre-sleep routine. Activities like reading a book, listening to calming music, or gentle stretching can cue your body that it's time to sleep. Mind your bedroom environment. Temperature control is especially important. The ideal sleep temperature is around 18-20 degrees Celsius, 65-68 degrees Celsius. When to see a doctor. If sleep problems persist despite lifestyle changes, it's important to consult a healthcare professional. Warning signs include loud snoring or gasping during sleep, excessive daytime sleepiness, persistent difficulty falling or staying asleep, unusual movements or behaviors during sleep. A sleep specialist may recommend a sleep study to diagnose conditions like sleep apnea or periodic limb movement disorder. Final thoughts. Aging doesn't have to mean accepting poor sleep as inevitable. With the right knowledge and habits, you can enjoy better, more restorative sleep well into your later years. Sleep is one of the most powerful tools for maintaining youthfulness and health, a natural fountain of youth everyone can access. Start by understanding your unique sleep patterns, making small but consistent changes, and seeking professional help when needed. Your brain and body will thank you. Thanks for watching. If you want more science-backed tips on healthy aging, don't forget to subscribe and ring the bell. Share your sleep struggles or successes in the comments below. Let's learn from each other.